Hi, Chris here from Truly Holistic. In this video I want to talk about a really important micronutrient, and that is magnesium. Uh, one of the main reasons why magnesium is so important in this day and age at the moment is one, majority of us are deficient in this really, really important micronutrient. And also the fact that it's involved with so many enzymatic reactions that happen within the body in all different parts of the body, so therefore it plays a role in regards to many conditions and diseases that are currently out there, and also the fact that calcification, so high calcium, is such an issue, and the ratio and the balance between the two alkaline micronutrients of calcium and magnesium is so important. And the issue that we have such high epidemic of calcification problems and high calcium problems is because we are deficient in magnesium. So in regards to calcium with magnesium, the ratio of it, calcium hardens things, magnesium softens things. It's the yin and the yang, kind of essentially, with magnesium and calcium. Now, when we increase the amount of magnesium, then the amount of calcium drops to get a ratio that is beneficial for the body. Okay, and if one of them is higher than the other in extreme quantities, then we have issues. A bit like sodium and potassium as well in regards to electrolytes. So now let's talk. I'm going to talk about the things in correlation with illnesses and diseases that we have out there today. For example, heart disease. Now, the amount of magnesium you have in your body is correlated with cardiovascular problems. Okay, and heart disease is just a massive epidemic. And the thing with heart disease is, it's not getting any better. And all the recommendations that are currently out there in regards to preventing and reversing heart disease in regards to mainly the cholesterol theory isn't really cutting the mustard. But it's not making the epidemic, it's getting worse. We're not improving the incidence of heart disease. We're not reversing it. We're not eradicating that disease by this particular theory. So you would have heard of a video that I've done a wee while ago in regards to heart disease, the real causes of heart disease. And cholesterol is such a minor player in regards to heart disease, where calcium and high calcium and calcification is a big one. And that's why magnesium is so important, because we can prevent this calcification happening within the capillaries, the arteries, the veins, and the heart itself. So let's take, for example, a big predictor of heart disease is high blood pressure. Okay, not cholesterol levels, high blood pressure. And now, magnesium, deficiency of magnesium causes high blood pressure. You taking dosages and good dosages of magnesium, you can actually reduce your blood pressure. Okay, magnesium is actually deemed a natural calcium channel blocker. Okay, and that's a drug we use to treat high blood pressure. So, why instead of using a pharmaceutical drug, let's look at the real causes of the issue. And if magnesium works in this way, then magnesium is going to be fantastic for your heart. It's the most important mineral for your heart. The fact that potassium gets mentioned so much in regards to heart health, really, I think magnesium is even more important. It's also a vasodilator, so it dilates all the blood vessels. So more blood flow, more oxygen can get to a heart. So that's only a good thing in regards to conditions like angina, where all of a sudden not enough blood flow, the blood's getting thick, or there's obstruction in a main artery, and then all of a sudden you're not getting enough blood flow, therefore you're not getting enough oxygen to your heart muscle, and you get heart pain and chest pain, you get shortness of breath, a lot of the symptoms of what we call angina. And more importantly, the initiation of a heart attack, myocardial infarction, where a part of the heart muscle died because it wasn't getting enough oxygen supply at the time, because of an obstruction, a damage to the endothelial cells on the layer of the smooth muscle tissue, what makes up your your pipes and your tubes of your cardiovascular system. That's right, your arteries and your veins. So, and there's a number of things that cause damage we're not going to go into in this video. But now, there are certain other medications that are used for people that have like congestive heart failure, where the muscle, because remember, important thing to know is your heart is a muscle. It's the most important muscle in your body, and smooth muscle tissue, which makes up, as I say, all the tubes of your cardiovascular system. So that's arteries, your veins, your capillaries, all made out again. It's all muscle, So, diuretics are a medication that people use for congestive heart failure because they end up accumulating fluid on the body. And these diuretics create you to get rid of this fluid. But the issue with it is there's no balance in regards to these diuretic medications such as furosemide. And you can become very deficient in certain electrolytes, magnesium a big one. So very careful, as well as potassium. It's deemed a medication to remove fluid off your body, but really it's going to cause further damage to your heart in the long term, because it's going to create a deficiency of both magnesium and potassium, which are vital for your heart and cardiovascular health. Now, arrhythmias, cardiac arrhythmias. Now, these are the rhythms and the rates of your heart. So, when our heart's beating well, it's in sinus rhythm, and when it's not in sinus rhythm, it's in an arrhythmia, which means unnatural rhythm of the heart. A big one is atrial fibrillation, AF. And now, magnesium is fantastic for treating arrhythmias. Okay, quite often if you have a arrhythmia problem, it usually means you've got a magnesium deficiency. And it really is a serious competitor in regards to pharmaceuticals with treating arrhythmias. Actually, in pharmaceuticals and treating arrhythmias, quite often magnesium is not the first choice, funnily enough. So in your hospital, by your doctor, they'll quite often treat arrhythmias with a drug that's a beta blocker, which is called metoprolol, and also quite often digoxin. And then about third or fourth option down the line, especially this is if you're in hospital, is you get started on magnesium infusion, magnesium sulfate, and quite often that does the job. And it's sometimes we kind of think, well, why is that the fourth option? It shouldn't be the first option, and we should be getting people on magnesium supplements and magnesium therapy when they go into the GP, in regards to these sorts of issues. Now, a lot of the reason why magnesium is the fourth option instead of the first option is because a lot of doctors are uncomfortable with treating people with nutrients and nutritional supplements because they're not trained that way. When they're at medical school, they learn about diagnostics, and they learn about pharmaceutical drugs to treat. And a lot of the time, they only really study a few hours of nutrition. And so therefore, when it comes to any nutritional supplement, they're kind of a bit lost in regards to, and they're a little bit scared of using it, which it makes me laugh a bit, because a lot of these nutraceuticals and a lot of these nutrients are very safe to use, unless you're using massive dosages of it or doing it IV. Then side effects can occur because you're giving the body a huge dose. But for most cases, in regards to oral supplementation, you can't go wrong, where pharmaceuticals have huge amounts of side effects. You look at the packet, and you look at all the medications, they create so many side effects. It's just not funny. So other things in regards to heart disease. Now, for women, one thing to know is that if you're taking oral contraceptives, is that can cause magnesium deficiency as well. A lot of medications cause magnesium deficiency. Now, another thing with magnesium are great for bones, okay? I believe, just as important as calcium. But with calcium, there's a lot of other issues that can occur with supplementation of calcium. There's been studies to show that you're higher risk of having a stroke or a heart attack by taking a calcium supplement because of this calcification problem. if it's not getting absorbed into where you want it to be in the bones, then it can create a big problem. Where with magnesium, not so much. So therefore, I think it's a lot safer option in regards to building bone density, which it's been shown to do. Obviously, it prevents heart disease, as we've just mentioned. Also, magnesium can keep you calm and also help you with sleep, because it does have sedating qualities to it, especially in a particular way of giving it transdermally when you apply it onto your skin, which we'll talk about in a minute. So magnesium does have sedating qualities. It actually can help with your mood and so on. It can help with migraines as well, because migraines quite often is a restriction of blood supply in regards to your cardiovascular system, and also tension in the muscles. So magnesium can dilate the cardiovascular tubing, let's say, and also can relax the muscles and your connective tissue as well. It's fantastic for women, when they've got menstrual cramping or period cramping, because it's a natural muscle relaxant, because again it relaxes all smooth muscle tissue, and also, as I say, it's great for anxiety because it's got sedating quality to it. In regards to diabetes, now diabetes, magnesium is critical, because magnesium is very important for blood sugar control. It controls carbohydrate metabolism, magnesium, by influencing a release and activity of insulin. And so therefore, this is to do with resistance and sensitivity of insulin. You would have heard people with diabetes, they have insulin resistance. Okay, and what you want the cells to become more sensitive to insulin, which people that don't have diabetes have sensitivity to it. But when you become diabetic, you become insulin resistant. So magnesium can really be preventative in that measure, but also with intense magnesium therapy can help to reverse your diabetes as well. Now, magnesium deficiency is always a sign or indicator of pre-diabetes or diabetes, and diabetics they're found need more magnesium and actually end up losing more magnesium because of the condition. So if anyone out there that's a diabetic, whether you're type 1 or type 2 diabetic, magnesium is a great mineral for you to be supplementing with. Now, prolonged use of magnesium will prevent chronic complications from diabetes. So you would have heard in regards to nutrient therapy or using supplements, they're great for preventative measures, but when you've got a condition and it's too late, well, they've actually found that magnesium, prolonged use of magnesium will actually prevent further complications if you have the condition. And we know all complications in regards to diabetes is your peripheries, you lose circulation to the peripheries. Quite often, if your diabetes isn't well controlled, quite often, people can lose a toe or they lose circulation to the peripheries. So magnesium is vital for preventing those sorts of issues, as well as I said, cardiovascular disease and diabetes go hand in hand. So, if you're getting magnesium, it's going to just benefit your body in a holistic way all over. Other things in regards to, as we mentioned earlier in the video, was calcium problems. Now, high calcium intakes will make the magnesium deficiency worse, because again, as I say, there's a ratio balance. As you go higher up in calcium, you'll drop in magnesium, and vice versa. So you want that ratio balance well. Now, we hear it on the news, on TV, our mainstream nutrition advice and dietitian advice is that calcium this, calcium that, we need calcium, we need calcium, we need calcium. When really the opposite should be being said. We need magnesium, we need magnesium. We are getting plenty of calcium in our diet, and it's going to be just pushed so strongly because of of business, dairy, and magnesium is becoming a lot more deficient in our topsoil. And magnesium is so much more vital, and we need to be consuming more magnesium and taking magnesium therapy as well. And we'll talk about sources of magnesium later in the video. Now, in regards to calcification and calcium problems, because it causes heart issues, it hardens the arterial wall. Again, the endothelial cells in the arterial wall, the calcium does that, causes calcification. That alongside sugar causes an inflammatory response there, which then tells the body to send cholesterol there to patch up that damage. Okay, cholesterol is there to actually help, and it's found at the scene of the crime, but it wasn't the perpetrator, and you need to understand that. And if you don't sort that problem out by rebalancing the calcium magnesium ratio and try and remove that calcification, trying to remove the sugar out of your diet as much as you can, then cholesterol will just keep getting sent there. Because your body, you're not listening to your body, essentially, and the body communicates to you all the time. So anyway, they did a study where they measured the change in coronary artery calcium in 495 patients that were symptom-free at the start of the study. Okay, now they followed every one of these people for 3.2 years. Okay, and 41 of the 495 had heart attacks. Okay, now the people that didn't have a heart attack saw a level of artery calcium increase by 17% per year. Okay, as I've said in previous videos, that calcium is accumulator, because the body is a filter, and if you're consuming too much calcium and not the right calcium, a lot of the limestone calcium that comes from our water supply, we accumulate that, and it accumulates in certain areas like the artery. It could be gallstones, it could be kidney stones, it could be calcium in the brain, so dementia, Parkinson's, all these conditions. Many conditions, it could be cirrhosis of the liver, calcium in the liver. So this is really what aging is all about. It's accumulation of products that the body can't get out of the body. So accumulation of toxins and things are not right for the body. It's not just about time, over time, that we just age naturally. Of course our cells replicate and they need to keep replicating, but we are increasing the rapid pace of our aging due to this issue in regards to calcification. Anyway, let's continue. So 17% increase in the people that didn't have heart attacks. Now, for the 41 that did have heart attacks, they saw an increase of arterial calcium of 42%. Okay, so a massive correlation in regards to more calcium in the artery, more incidence of a heart attack. Okay, so 42% for the 41 people that had a heart attack, 17% for the people that didn't. Okay. Now, another thing to mention here, and this comes back to this again, cholesterol theory. One thing they found was that LDL cholesterol, which is deemed the bad cholesterol in regards to this theory, LDL cholesterol did not differ between the two groups, the people that had the heart attack and the people that didn't have a heart attack. There was no difference. Okay? So, in regards to sleep, now, magnesium is very vital to sleep. It's something that, no one really seems to use it for sleep, and I tell you, it is fantastic. Okay? Now, there was a researcher, Dr. Davis, that used magnesium chloride as a means of combating insomnia. The doctor did a study, reported that sleep was induced rapidly, was uninterrupted, and waking tiredness disappeared in 99% of the patients in that study. That is incredible results. Why it does this is because it has a sedating quality to it, because it's a muscle relaxant. It relaxes all smooth muscle tissue. Okay? It removes tension out of the body. Okay? Removes anxiety from the body. Calms the mind. These are all things that we need to take into account why we're not really sleeping very well. Now, so magnesium is an anti-stress mineral. Okay? So we're going to talk about the sources of magnesium you can take now, which are going to help for these sorts of things. And we're going to talk about individually the different ways of taking it. So magnesium, you can take it as an oral supplement. The only issue with taking it as an oral supplement is that there are some digestive tolerance issues, especially if it's mainly magnesium oxide. Okay, you want to go, in regards to an oral supplement, you want to go towards more magnesium bounded with or chelated with a amino acid, or even better, go to magnesium chloride, which is the best absorbed form of magnesium. Okay, so why there's a digestive tolerance in regards to magnesium is because it relaxes smooth muscle tissue. What is your digestive tract? The tube that goes from your mouth to your bottom is all smooth muscle tissue. So if you get to a certain amount of magnesium orally, you can only go to a certain dosage, and you'll notice that you're just starting to get loose bowels or a bit of diarrhea, a bit like vitamin C. So, as I said, it's shown to improve insulin sensitivity. Another source of taking a magnesium sulfate, which you can actually get magnesium sulfate Epsom salts and place it in a bath if you have a bath, and that's a lovely way of absorbing magnesium through the skin transdermally. And if anyone's done it, you'll know how relaxed you feel after doing it. Another way of taking it orally is getting a supplement which I really recommend. It's called concentrated mineral drops, and it's got 72 plus minerals in it, but the main mineral in it is magnesium chloride. And it's a very bioavailable form, ionic form, which is easily absorbed by the body, and you just place it in any liquid that you're drinking, water, juice. It could be even beer or alcohol if you wanted to, and you can place it in your food stuff or soups and those sorts of things just to increase the mineral content as well. It is really beneficial. Now, if you want to really do magnesium therapy and taking big dosages, you want to do it transdermically, so doing it through the skin. So you can buy a magnesium oil. So it's made of normally magnesium chloride because, again, it's the most bioavailable. And this avoids having to have this digestive tolerance problem. It also, if you combine it with heat therapy as well, it increases circulation to that area, so it's great for analgesia, like for pain relief. If you've got a sore hip, then you just apply magnesium oil to that hip with some heat, with a heat pack, and all of a sudden you're increasing the circulation to that area. And I tell you, within minutes, your hip will be working a lot freer, and it'll lessen the pain as well. For a personal example, the other day I'd done a workout at the gym, and all of a sudden, I was a bit stiff around the pelvic and hip area, and I was bending down to just put my socks on. I was struggling, and it was really sore. And then all of a sudden I thought, right, I'm going to put magnesium chloride, the oil, onto my skin, around my pelvis, around my lower back and my hips. Within 5 minutes, I could put those socks on easy. There was no pain, no resistance, no stiffness. It was incredible. It worked very quickly. Now, what you'll notice when you start to use this magnesium oil, this chloride, because it is a concentrated dose, that on your skin that it may get quite tingly and it will sting a little bit initially, but as your skin becomes a bit more tolerant to it, your body becomes a bit tolerant to it, you won't have those issues so much, and it's fantastic anyway. As I say, the magnesium sulfate is a good form, but not as bioavailable as magnesium chloride. So Epsom salts are still great. You can also even add sodium bicarbonate as well, which will give you a bit more of a detoxification in regards to having a bath as well. Now, regards to nutrition. Now, magnesium is high in cacao, and cacao is raw cocoa powder, so from what makes up chocolate. So cacao is really high in magnesium, And leafy greens are high in magnesium because chlorophyll, which gives it that green pigment, is essentially identical to hemoglobin in our blood, but the center atom of chlorophyll is magnesium, while the center atom of our hemoglobin is iron. So it's kind of the lifeblood of plants is magnesium. So anything green, pigmented is going to be loaded with magnesium. You can also get magnesium with nuts and seeds as well. But I do really recommend, with the lifestyle that we live today, where there's so much calcium that we're eating in our diet, all the bad forms of calcification and limestone in our water supply, especially if you're drinking from town water supply or the tap. Even if it's filtered tap water, it's still going to have these contaminants in it. You want to go towards more of a spring water if you want water without so much calcification in it. And well water can also be high in calcium as well, so you've got to be careful about that. So ideally, for me, I think people should, this is one supplement people should be taking, is magnesium. And if you've got a deficiency in magnesium and you have these conditions which I've mentioned in this video, it's probably best to be taking magnesium orally as well as transdermally, and getting the magnesium oil and applying it to your body, whether that's all over your body or whether that's a certain area of the body where you have these issues or pain issues. You can use it. And me personally, I don't take a magnesium supplement, but I do take concentrated mineral drops, as I say, at very high magnesium, and also apply magnesium oil to my skin every day, and also do cacao smoothies, and also eat a lot of greens as well. So magnesium is really vital in the lifestyle that we live today. And I hope you've learnt a bit more about this vital alkaline mineral or a micronutrient by watching this video. Thanks.